Gallbladder surgery can be done several ways. Historically, up to about 20 or 30 years ago, it was done by an open incision under the ribs on the right side, and people would spend a week in the hospital, and that was a pretty miserable operation. Often people would say that the cure may be just as bad as the disease. But in the early 90s, late 80s, laparoscopic surgery came along, and that is now the standard way to remove the gallbladder. It's usually done as an outpatient operation, and some people will refer to it as laser surgery, but laparoscopic surgery involves tiny incisions in the abdomen, blowing the abdomen up with air, using a camera to visualize things and remove the gallbladder. Almost every patient who has gallbladder surgery in this day and age is a candidate for a minimally invasive approach. It would be very unusual to anticipate that someone would have to have surgery the old-fashioned way with the incision under their ribs. Even someone who's had multiple prior operations, even operations in the upper abdomen, we can almost always safely remove the gallbladder via a minimally invasive approach. We do still convert people to the old-fashioned operation. I usually quote patients about a 1% chance of that occurring during our preoperative discussion. And the reasons that we would convert someone to the old-fashioned or open technique really all revolve around safety. If there is a lot of scar tissue from prior surgery, or we do get into bleeding, or the other reason would be if we're just uncertain of the anatomy of the different ducts and blood vessels, then we want to do it safely. The recovery from gallbladder surgery done by a minimally invasive approach is usually measured in days, not weeks. For someone who has a non-strenuous job or a desk job or does a fair amount of walking, they could be back to work as early as 5 to 7 days from surgery. We often will hold people out a little bit longer if they do have a heavy activity job, construction worker, or someone who does a lot of driving, for example. But even in that time period, people are very active. After surgery, most people don't have to change their diet. That's one of the questions I get a lot. It's been a presumption for decades that after removal of the gallbladder, people will have frequent diarrhea. And there's no doubt that some people's body will miss the gallbladder. As I said before, the gallbladder is not a worthless organ, but it seems that most human bodies will adjust to not having it. So I caution people who are anticipating having gallbladder surgery that they may very well find certain foods for the first few weeks or months that do send them to the bathroom, but at least as reported to me over 15 years of surgery, I just don't hear it very often that every time somebody eats after gallbladder surgery, they end up running to the bathroom. So I sort of encourage people to take a wait-and-see approach, keep trying foods, because the body will probably adjust. There is not a list of foods to avoid. It's interesting that it is unique to every individual. And I would love to be able to tell people, you know, don't eat foods A, B, and C, but it really boils down to trial and error.